Hello, everyone, and welcome to the Champ Software Expert webinar series. We have a wonderful speaker with us today. Brianna Case is the Operations Specialist for Webster County Health Department in Fort Dodge, Iowa. With 5 years of experience at the agency and a background in medical office management and insurance billing, she brings a wealth of knowledge.
Objectives for today: utilizing custom forms and custom tabs. We're maximizing our electronic charting and reducing administrative burden with consents and releases. Building reports. We utilize reports for key metric analysis, follow-up tracking for some of our programs. We also use Nightingale Notes for staff time tracking, and that has a lot of great benefits when it comes to looking at your budgets, your time spent, your FTEs, your full-time equivalencies for staff. Simplifying billing. I love Nightingale Notes. I've built in a lot of different softwares, and Nightingale Notes allows us to track revenue outstanding balances and improve billing practices. And then we have used Nightingale Notes to kind of think outside the box. We just released an incentive tracking program that we are using to help people, high-risk families, receive services that include maternal health, fiscal assistance, housing, and working with the different community organizations. And this incentive program will hopefully encourage people to take part in all of the programs across our community. So we're using that incentive tracking piece. So here's a couple snippets from how we use custom forms. So we have our release of information form for our maternal and child health services. We have our Spanish and English versions of that. And we also have our consent forms. So, but the nice thing about this is you can utilize a lot of different formats to create a working document. So you can have text boxes, you can have where people can sign, you can have check boxes, drop down, static text, and more. With the custom forms, you're able to make fields required so that you have those date of births, the insurance policy number, and the form cannot be turned in without having that information. So that helps. And then when you have the required information and it is those demographics, then you can pull that through and update it as needed. That's extremely beneficial with our high-risk families too, because oftentimes they have frequent address and phone number changes, and it helps us keep track to make sure that they're the most up-to-date. So this is what it's going to look like on your computer tablet when you send out a QR code or link to the client. So you can copy your QR code and link, or you can even show them the tablet. Say they're in a waiting room and they need to fill out a form, they can snap it on their cell phone and fill it out while they're waiting. A lot of our nurses have really appreciated having, say, touchscreen laptops, because instead of carrying a signature pad and carrying your laptop or a tablet, they can use their finger right on that touchscreen laptop to sign and save, and that works well. So how have we used custom forms? Immunization consents, you can send them to schools, businesses, patients ahead of time. That was really big when our COVID clinics hit, when we had to do a large amount of vaccine services. We were able to get consent forms ahead of time, be able to say, okay, do we know who this client is? Can we verify their insurance ahead of time? When you have, say, your BFC or your Medicaid eligible vaccines versus your private insurance, to be able to look at that insurance ahead of time, make sure that you're using the appropriate vaccine, you're able to get reimbursed from insurance, and you make sure that they have the most up-to-date insurance information. We also have our entire home health intake packet built in there. So we can capture all of that and have that on file. Home health is a lot of paperwork, so it saves on that printing cost as well. So we talked about custom forms, but what about custom tabs? What are the differences? So custom forms are a great way to capture consents and releases, but custom tabs are a great way that we capture key charting pieces that are required for our grants or programs, but not necessarily built into Nightingale Notes as it exists. So how do we use them? We provide dental service documentation. We use them for mileage tracking, intake, referral, and care coordination, communication between our staff internally, but also our staff within that 7-county service area, and immunization eligibility determination. So here is a good example of intake assessment that we have built in as a custom tab. So with the intake assessment, we are asking, do they have medical care? Do they have medical insurance? When was the last time they had a well child exam? Is their immunizations up to date? This allows us to capture that information for a couple of different reasons. One, it collects data for us at a local level to help support the services that we're providing. If we can pull our intake assessments for all of our clients and say, hey, we've seen an uptick of individuals that don't have medical insurance, or let's pull a list of all of the people who put my child's recent medical visit hasn't been in the past year. That can give us a list of who we need to provide additional care coordination to. How do you pay for your child's dental care? Do we need to assess with our local county political figures that we have no dental resources here for families? Data supports that, and we are able to pull that information in Nightingale Notes to help us pose questions and how we can do things better in our community. And all of that is captured under these custom tabs. So speaking of building reports, let's go on to that. One of the biggest things with public health is data. It's being able to identify the need in your community based on data, and also providing the documentation that supports the services you're providing and gives you credit with the state level and the grant officials of, hey, we are meeting the requirements of our work plans. And we use Nightingale Notes a lot for reporting. So why does reporting matter to your agency? Do you need to track that data for programming, for local area boards, for funding? Do you need to determine staff time across programs to maximize resources and ensure budget constraints are being kept? Do you want to track when services are due for clients? Do you track outstanding balances and payments by either service or by payer? So staff time and programs are huge. We want to make sure that, we have adequate staffing and our staff are maximizing their time based on how they're budgeted in programs. Because if you are overspending in one program and underspending in another, I can't just take the money from one to pay their wages. So it allows me to get a good snapshot of where everyone is at with their time and make sure we spend all of our funding and we do not overspend as well. So I can pull a report that says how many hours were spent on outreach, how many hours were spent on our dental programs. So you can divide it by service and program to get a good snapshot. So we utilize this to report to our local boards of health, allows policymakers to identify gaps in services. Many grants also want to know our demographics for individuals receiving services and the number of services provided during a particular period. We break that down in our reporting tools, say by insured versus uninsured, counties within the service area, and by programs. So in addition to great reporting tools and being able to build reports, we also have dashboards. While we were having our meeting that I met the staff through Nightingale Notes, they introduced me to dashboards, and we've already in the last few months used it for a lot of different things, especially from a supervision level for my executive director and I to keep track of our staff, our programs, and what we're doing. So here's a couple of examples of reports for financial oversight. These are directly from our electronic health record. You can see that we've got our outstanding balances for our home health services, maternal health, public health, and child health. You can toggle between what is current, what is over 90 days. It's very customizable. You just click on these and it'll pop up your over 90 days versus your current. And you can see there's menu options to expand. Do I only want to see the top 5 payers that have outstanding balances? Do I want to see all payers? Do I only want to see home health outstanding balances? That allows you to do that. Time by cost center is probably my most very favorite part of the dashboard. And the reason is that allows me as our fiscal agent to track time spent for each program to ensure our budgets are being met. We're not over or under spending. Our staffing requirements are being met. We're not over or underutilizing our staff. And it determines our cost allocation for split or shared expenses. So if you have an office of 10 programs, you buy paper for all of it. This allows me to tell how much our child health is going to have to use that paper cost versus our WIC program. Next, let's discuss billing and why it is so easy and all of the features that I love. So it allows you to do claim processing, easy error correction, payment posting, and billing reports. The last thing I want to discuss before we kind of get into some questions and discussion is thinking outside of the box. How have we used Nightingale Notes in a way that might not be very common? So I mentioned that we have connecting counties within a service area. So one of the biggest things we use Nightingale Notes for is communication and care coordination within our organization between staff. When you have staff coming and going to provide services out in the community, it's very hard to get a hold of people. You know, you don't want things to get lost in email, and you want to have a record at a client level that you have discussed things and followed up on them. So we use that for intake. When we get a fax, we scan it in at the client level. When we get results from a provider, we scan that in at a client level. When we refer internally from one of our programs to another, that also gets documented.
I wanted to just take a moment and tell you thank you so much, Brianna, for sharing today.